Hi everyone, welcome to the CANPoint Point Prevalence Study Site Initiation Visit. My name is Marie-Hélène Masse. I'm the Clinical Trial Manager of the study. So today I will go over the presentation for about 20 minutes. And please fill out the documentation of this training and send it to Julie Ménard. So today I will go over the contacts, essential documents, study training, site activation, the objective and outcomes of the study. I will show you a flow chart of the study. We will review procedures, the CRF and the ECRF. We will also discuss about the definition of ICU and the categories of ICU. I will give you a few instructions for specific questions in the CRF. And finally, we will discuss about reimbursement. So as I said, I'm the clinical trial manager. Here are our team. So we have Julie Ménard and Monica Sheen, who are research coordinators. So they will have access to the database and they might communicate with you to ask you questions or clarification about the data you will have entered in the database. And Julie Ménard is the contact to send your documents prior to your site activation. Joannie Martineau is our administrative assistant, so she's in charge of payments. She might already have contacted you to have information about the payments. François Lamontagne and Neil Adhikari are the two principal investigators, and Dr. Fowler, Dr. Murty, and Dr. Ko are also involved in the study as co-investigators. So I sent an email a few weeks ago asking you to send documents to Julie Ménard in order to be activated. So you need to send your protocol signature page signed. So you can find this document on page 4 in the research protocol. Also, the site agreement must be fully executed. You also must send your RAB and institutional approval, your signed delegation log, and for the site investigator only, we need is a good clinical practice certificate, so the GCP certificate, is CV and medical license, and this PI, this local investigator, must be a physician. So all these documents must be sent to Julie Ménard before June 26th. So once she will have all these documents, she will be able to activate your site. For the other persons that are listed on the delegation log, please make sure that they are trained on the GCPs, so they have their GCP certificate. You have their CV dated and signed, and their license if they have one. So these documents are not needed to be sent to our coordinating center. You can keep these documents in your regulatory binder at your site. So today, we like the study training must be documented, and everyone on the delegation log must be trained on the study. So if you are not able to attend one of the 3 training sessions that were planned in June, you can listen to this recording, and please make sure that everyone listed on your delegation log has had been trained on the study and that they have signed this training document. Once everyone is trained, please send also this document to Julie Ménard. So as I said, once the training is completed for everyone and all the essential documents are sent to Julie, we will activate your site. So Julie will send an email confirming your site activation. And she will also provide username and IDs and password for the REDCap database. Now, the objective of the study. So, the objectives are to advance the development of a learning system for critical care in Canada. So, at the system level, we want to create a contemporary registry of level 1 to 3 ICUs across Canadian acute care hospitals and determine the occupancy rate at 3 time points during each calendar year. At the patient level, we want to determine the condition, disease that define the burden of critical illness in patient admitted to these ICU at each time point. At an intervention level, we want to determine the resource-intensive interventions delivered to individual patient admitted to these level 1 to 3 ICUs at each time point. And at a research infrastructure level, we want to identify the ICU that are able to collect and submit complete patient-level data to these point prevalence studies and the barriers encountered by non-participating ICUs. The outcomes are the ICU level and occupancy rate, the conditions that define the burden of critical illness in patient admitted to Canadian ICUs, the resource-intensive intervention delivered to ICU patients, and the capacity to participate to this point prevalence study and barriers encountered by non-participating ICUs. So now here is the flow chart of the study. So as you know, in January, we have sent invitation letters to all hospitals in Canada that have acute care units, so ICUs. And we had a first time point of data collection on March 31st. Now, the second point of data collection is planned on July 3rd, and the next time point should be during the fall. I can't tell you now the date, but it will be announced about a month before this date. So, as of today, we have funding for a year, so until December. And if we obtain more funding, we might extend the study and have more time points over the years. So we want to collect data about ICUs in your hospital and patient hospitalized or awaiting ICU admission at 9 a.m. on the day of data collection. So who should be included in the study? So all patients admitted to the ICU of participating site will be included. And as I said, we have invited all acute care hospitals across Canada. There are no exclusion criteria. The data collection of all patients in ICU and those care outside the ICU are included. So in other words, on July 3rd at 9 a.m., you will look in your electronic medical record and you will look how many patients you have in the ICU. You will take your master list and you will make sure to collect the medical chart number of each patient that is hospitalized in your ICU, plus all the patients that are awaiting ICU admission. So what does it mean? So if you have, let's say, one patient in the emergency room that is under the care of the ICU physician, but waiting for his bed in the ICU, this patient must be included. So you list all the patients that you have, and then at 9 a.m. on the day of data collection, and then you will start to collect data on each of these patients. So it's really important that at 9 a.m. you look in each unit and you list the patient that must be included in the study, and then you start data collection after. So all data must be collected prospectively, so on the day of data collection, and these data can be collected first on paper. And if you prefer to collect data on paper and then enter the data in REDCap, that's fine, but it must be done within 7 business days. If you want to enter the data directly in REDCap, that's fine as well. So once done, Monica and Julie will review your data, and they might put some queries in the database or send you some emails with questions. So please make sure to answer those queries as soon as possible. And we ask the site to answer these queries also within 7 business days. So you might have noticed that we have 2 versions of CRF, one for adult and one for pediatric. So you must look at the age on the day of data collection. And if the patient is 18 or over, you will use the adult version of the CRF. If the patient is below 18, you will take the pediatric version of the CRF. So the CRFs and the operations manual are available on the website. Please make sure to look at the website and download the last version of the CRF, especially for the sites that have participated to the first data collection. So please make sure a day or two before July 3rd to go on the website and use the right version of the CRF. So once your site is activated, you will have received your username and password, and you can access the REDCap database through the link on the screen. And the first time that you will enter data in REDCap, like for your first patient, you will have a question. The question in red below. Is it the first time that you answer question about intensive care unit in your hospital? This question must be answered yes for the first patient that you will enter. Okay. And for the sites that have participated to the first data collection in March, they still have to answer yes to this question for their first patient of this data point. Why? Because this question, the sub questions that you will have are about the number of units that you have in your hospital. So you will have to indicate if you have 4 units in this example. You will give a name to each of these units, and you will have to describe the level of ICU. So 1 to 3. We will have a definition in a few minutes. You will have to choose the population, so adult or pediatric, the number of funded beds, and if you will collect data in this unit for this time point. So, for example, there are sites that have a lot of ICU, like 10 ICUs, and they don't have the capacity or enough people in the team to collect data in the 10 ICU at this time point. So for each ICU, they will have to indicate if they will collect data in this ICU or not for each of the 10 ICU. And if they don't collect data in one of these ICU, they will have to provide a reason. And as soon as you say that you collect data in one ICU, all the patients in this ICU must be collected. It's 100% of these patients must be collected. So now, what is an ICU? And that's a difficult question. And since this study is want to mimic a pandemic, we wanted to be more inclusive than usual. So this means that I won't read this definition. It's in the operation manual. But bottom line, normally when you participate to studies, you say that you have 2 ICUs, but when you will review this definition, you might have more than 2 ICUs. So this definition must be reviewed by you and your local principal investigator, and you must decide carefully with the principal investigator how many ICUs you have. So does it qualify as an ICU or not? If it's still unclear, you can send an email to me or to Francois and Neil. We'll make sure to answer before the day of data collection, but we will ask you two questions. So, what distinguishes that unit from a regular ward bed at your site? So, in terms of patient nurse ratio, the monitoring, the ventilation, vasopressors, and what distinguishes that unit from a straightforward ICU bed at your site? So, that would be the two questions that we will ask you, and that will help you and us to decide if it should be included as an ICU in this study. Now the ICU categories, so level 1, 2, and 3. Again, I won't go over the definitions. It's all in the operation manual. On the website, you have this operation manual. Again, for each of your ICU, you will have to select if it is level 1, 2, or 3 ICU. So again, it must be define with your local principal investigator. So this task of deciding or defining how many ICUs and the level of each one, you should do that before July 3rd. And you can like record this already in the REDCap database if you want, create the first patient and enter each unit information. So in fact, that will help you at 9 a.m. on the day of data collection to look in the right units. So the ECRF, which is REDCap, as you know, for the sites that have access to more than one site, please make sure to have to select the right hospital when you enter your patient. So just in the section in blue at the top, you have the name of the hospital. And as I said, if you have access to more than one, you have this blue button on which you can click, and you will have a drop-down list with each hospital. So you just have to select the right one and click on switch, and then the name of the right hospital will be shown. So that's one important thing, to make sure that you enter the patient in the right hospital. One thing before we go to instructions. So for the sites that have participated to the first data collection point, I said previously that you must answer this question about each unit, and just as an FYI, the first patient of this second data collection will, if you had 25 patient on the first data collection, your first patient of this second data collection will be patient number 26. So don't be surprised. You won't start again at patient 1. You will just follow the next patient following the first data collection. Now, instruction for specific questions on the CRF. So ethnicity and gender. So ethnicity and gender, they must be documented in medical record to answer the question. So in other words, we ask you, is ethnicity documented in medical record? If it's not explicitly documented, the answer is no. You don't assume ethnicity, or you don't contact the patient. You don't ask the nurse of the patient. You only look in the medical chart. And if it is documented, fine, you then check what is the answer. But if it's not explicitly documented, the answer is no. Same for gender. And by the way, so sex is biological sex at birth, and gender is what the patient identify himself or herself to. So sex is really like something that is clear and biological at birth. Gender, it depends on the patient. Again, it I it's really not often that it's documented in the patient chart. If it is documented, then you answer the question. If it's not documented, you will answer that it's not documented, and that's fine. And you don't have to ask anyone, and you don't assume that if a patient has a female as a sex, that she then identify as a female. You don't assume anything. Um, so primary ICU diagnosis. So we want you, sometimes it's difficult, but we want you to really select the main reason for ICU admission. So really have only one reason. So baseline severity. So that's the raw data to calculate Apache. So we want these variables within the 24 hours following ICU admission. So, and yeah, so during really this closed window of 24 hours of ICU admission, if, for example, the patient was admitted on July 2nd at 8 p.m., so you will have from 8 p.m. on July 2nd until 9 a.m. on July 3rd. So this window will be short in that case. In all the other cases where it's at least 24 hours, you really, before the day of data collection at 9, you really take the 24 hours window from ICU admission or, yeah, so unless the patient was admitted on June 25 or before. Since it's like 7 days before, we don't ask you to collect data about Apache. So when you will enter the date of admission in the CRF, um, you will, if it's on June 25th or before, you won't have to enter any data on Apache. If it's 26 until July 3rd, you will have access to all the field to enter the variables. So if your site has the Apache score, the final Apache score, that's fine. We can, so you will have this choice in the CRF. You won't have to enter each variable in this case. And yeah, so temperature. So we added from the last version of the CRF, we added the option of tympanic temperature. And one specific instruction is that if you have different temperature type within this 24 hours, we ask you to enter, if you have two core temperature, that's fine, you enter the lowest and the highest. If you have also one oral temperature, you enter in the lowest and highest field the same value. We don't want you to calculate or assume which one is the lowest between different temperatures. So again, I repeat it. If you have, let's say, two core temperature during a day, the 24 hours, you enter the lowest and the highest. And if you have also, let's say, one oral temperature and one axillary temperature, you will have in the oral line in lowest the value and the same value in highest and axillary as well. So that's it. PF ratio. So this was something that we had to explain more to sites when we did the monitoring after the first day, the first date of data collection. So it is really well described or explained in the operation manual, and I would like that everyone look in the operation manual to make sure that you collect or enter the PF ratio correctly. So the first instruction is that if you have arterial blood gas, you must use arterial blood gas for the PF ratio. So if you have only one arterial gas during the 24-hour window, then you will take the PaO2 and the FiO2 of this gas, and this will be your PF ratio. You will indicate the PaO2, the FiO2, and the corresponding PCO2 within this same arterial gas. If you have more than one arterial gas within the 24 hours, then you will have to calculate for each of the arterial gas during this 24 hours and select the lowest PF results of the PF ratio. So really that's the first instruction. Take arterial gas first. If you don't have any arterial gas during this 24 hours window, then you will use saturation to estimate the PaO2. So that's where I really want you to go in the operation manual and look at the examples that we have put in there. And this should be easier for you, and this will avoid back and forth for queries as well. Question 20 is also related. So if you have provided a PF ratio with a corresponding PaO2 at 19.1 to 19.3, this means that you have arterial gas and you should provide arterial pH. So if you only have one arterial gas during the 24 hours, you put the same value in the lowest and highest field. If you have provided values at PaO2, FiO2, PCO2, you must provide the value for the arterial pH. If you didn't have any arterial gas and you used SpO2, then you shouldn't have an arterial pH. You should have a serum bicarbonate. So please, again, go in the operation manual and review the section about PF ratio. So the intervention now. So there is a form about interventions, and we want you to indicate if yes or no they receive vasopressors, ventilation during the 24 hours prior to 9 a.m. on July 3rd. So from July 2nd at 9 a.m. until July 3rd at 9 a.m., did the patient receive vasopressors, ventilation, renal replacement therapy? That's really important to look at this specific period of 24 hours prior to 9 a.m. on July 3rd. Another clarification is about enteral nutrition. So here we mean is the patient fed? So if the patient eats by himself or herself, it shouldn't be checked as enteral nutrition. So it's really, we mean feeding. For patient care outside the ICU who are awaiting ICU admission, so again, these patients must be under the care of the ICU physician. And in this case, the 24 hours of the data that you will enter the physiologic variables. So the clock starts when the patient is under the care of the ICU physician instead of ICU admission, because it will be more, you will have the correct window. So anytime you enter a value outside the accepted range, there will be a message that will come up on the screen to ask you to confirm that you really want to enter this data. Study reimbursement. So for the new sites that will be activated, there is this 1,000 per site for the activation of the site. So again, it's one, the agreement is fully executed, the RAB approval is and the institutional approval is sent to us, and that all the essential documents and training documentation is received. So it's when your site is activated. And then we reimburse $45 per chart following each data collection. But it's really important that 100% of patients hospitalized in the ICU are collected. And as you know, we will monitor sites after the data collection. So we have a way to see if it's not the case. Data collection must be completed and entered in REDCap within 7 days. So this means that all your data must be entered in REDCap on July 14 at 23:59. So before July 15. And queries must be resolved. And we plan to proceed to the payments in August. So um, July 3rd is the day of data collection. You have until July 14 to enter data. Then Julie and Monica will validate data and put some queries. You have 7 days. So we think that in August we will be able to proceed to the payments. You don't have to send invoices or anything else. We will send you the payments and also a document detailing the payment. So if you have any questions, please send these to myself. I'll make sure to answer as quickly as possible. On the day of data collection, questions can be sent also to Monica and Julie, and after this date as well. So I think the best way is to send these questions to Julie, Monica, and me. Uh, sorry, and we'll make sure to answer as quick as possible. Thank you, everyone.